Hi there, and welcome to the introduction to the biomechanics of chiropractic and the hand contacts of chiropractic. Now, we have two tools that we use predominantly as chiropractors: our hands and our minds. If you can use these, whatever surface you work on, you will be a successful chiropractor. Okay, so it's really important, to take care of our hands, make sure that we protect our hands and we understand how to use our hands effectively and appropriately for the patients that we're working on. Now, again, I have two perfectly working hands. If you do have any adaptations, we have managed to adapt the course and the program for students who need this. So please come to me at the start if you do have any issues with your hands. And equally, if you do have any grip strength changes, we can discuss protocol around increasing that grip strength whilst you guys are in second year and moving forward. Okay, so let's talk about some contacts in the hands that we will use in a chiropractic term. We've got the palm of our hand, which we can use as an adjustment. We've got our thumb, which then goes down to our thenar. So you will hear a thenar contact being used, and as we come around, we'll have our pisiform as a contact, or we'll have a hypothenar. Your old school textbooks will often talk about pisiform, but for me, we will tend to use our hypothenar to adjust with, because if we're constantly using our pisiform, which is a small little piece-shaped bone, we might cause some irritation around that bone. So we just move our contact a little bit further up into our nice, strong hypothenar. And as you can see, I'm starting to flex to give the start of a chiropractic arch. And we'll talk about that in a second. Then your contacts further are your digits, your fingers that we will use for a lot of our contacts. And then you will use your thumb, for example, for a cervical adjustment. Then on our forefinger, this joint here we use for our cervical adjustments. Your contact of your articular pillar will sit nicely here, and you will reinforce it with the rest of your hand. So that joint is nice and strong and stable, but you get enough feeling and ability to feel what's happening with that cervical spine. Okay. The other contacts that we might use, if we're using soft tissue, for example, we might use our web. You might use a web contact for our mobilizations also. And then we will have a look at our elbows if we're using any of our soft tissue techniques, or our forearm. Our forearm we can use as a good gliding fascial tool, or a knife edge tool for the side of our hand. Okay, so that's how we can use our hands to some degree. Knuckles then are your other ones when we will start using for trigger points. So instead of using our thumb to trigger point, you can move to your knuckle, or you can move to your knuckle and try and offload your hands, because remember, these are the things that will keep you in practice, and these are the things that will keep you manipulating. Okay, and that was the summary of our hand contacts. Next, we're going to move into our biomechanics when we're doing any of our setups, our adjustments, and our soft tissue work.